Which carbapenem is co-administered with cilastatin to escape renal dehydropeptidase 1? Imipenem. Remember, imipenem hires cilastatin as kidney bodyguard. Drug of choice for neurosyphilis, IV that penetrates CSF even without inflammation? Aqueous penicillin G. Remember, Pen G digs deep into the nervous love sore. Speak to monobactam safe in life-threatening penicillin anaphylaxis, yet active against gram-negative aerobes? Aztreonam. Remember, AZ treats no amoxicillin allergy. Vancomycin inhibits cell wall synthesis by binding to which dipeptide terminus? D-ala. Remember, Van sticks like Velcro to D-ala. Single-dose oral antibiotic for uncomplicated cystitis in pregnancy that blocks Murray enzyme? Speak. Crosity rate 100%. Phosphomycin. Remember, phosphomycin flushes female bladder overnight. Third-generation cephalosporin with strong Pseudomonas activity? Ceftazidime. Remember, ceftazidime zooms at the pseudocar. Rapid IV infusion of which glycopeptide produces red man flushing? Speak. Vancomycin. Remember, Van arrives fast, paints patient tomato red. Once weekly lipoglycopeptide used for MRSA skin infections due to very long half-life? Speak. Crosity rate 100%. Dalbavancin. Remember, dalbavancin, one shot, done for the week. Carbapenem with lowest seizure risk, preferred in CNS infections? Meropenem. Remember, meropenem keeps the neurons mellow. Suicide beta-lactamase inhibitor paired with amoxicillin in augmentin. Clavulanic acid. Remember, clavulanic clamps beta baddies for amox. Speak. Prosody rate 100%. First-generation cephalosporin recommended for clean surgical prophylaxis? Speak. Prosody rate 100%. Cefazolin. Remember, cefazolin zips up surgical wounds cleanly. Preferred beta-lactam for Enterococcus fecalis sensitive endocarditis. Ampicillin. Remember, ampicillin amps down Enterococcus engines. Penicillinase-resistant penicillin used IV for MSSA bacteremia. Cloxacillin. Remember, cloxacillin clocks classic staph. Third-generation cephalosporin with best neonatal meningitis coverage alongside ampicillin? Cefotaxime. Remember, cefotaxime taxis through newborn BBB. Carbapenem marketed with Weber-Bactam to tackle KPC producers? Speak. Prosody rate meropenem. Remember, meropenem and Weber-Bactam form anti-KPC avengers. Lipopeptide antibiotic causing myopathy and rhabdomyolysis, especially with statins. Speak. Daptomycin. Remember, daptomycin dents muscles, beware with statins. Only cephalosporin active against MRSA approved for pneumonia? Ceftaroline. Remember, ceftaroline ropes the resistant MRSA cowboy. Vancomycin-resistant Enterococcus changes its target to D-ala-D. LAC. Remember, VRE swaps ALA for LAC, like lactose intolerance for VAN. Oral aminopenicillin preferred for otitis media due to excellent middle ear levels. Speak. Amoxicillin is the effective and inventive treatment. Remember, Amox bombards the middle eardrum. Which drug prolongs penicillin G half-life by blocking renal tubular secretion? Probenecid. Remember, probenecid protects pen-G from kidney ejection. Third-generation cephalosporin, notorious for biliary pseudolithiasis in neonates. Ceftriaxone. Remember, ceftriaxone turns bile into baby gravel. First-line drug for severe Clostridioides difficile colitis if metronidazole fails. Speak. Prosody rate 100%. Oral vancomycin. Remember, vancomycin vacuums C. diff from gut. Topical polypeptide that blocks bactoprenol dephosphorylation but is nephrotoxic IV? Bacitracin. Remember, bacitracin is for bacitracin, touch only, no drink. Target vancomycin trough concentration, MLE, in severe MRSA bacteremia. 15 to 20. Remember, keep VAN level 15 to 20 or Bugs Party. Lipoglycopeptide that causes red man syndrome and falsely prolongs INR tests. Telavancin. Remember, telavancin tells labs a fake clot story. Treatment of choice for Listeria meningitis, ampicillin plus synergistic X. Speak. Prosody rate 100%. Gentamicin. Remember, Listeria loves dairy, and plus gentamicin spoils the milk. Extended spectrum penicillin paired with tazobactam for hospital pseudomonas. Piperacillin. Remember, piperacillin pipes poison into pseudomonas pipes. Glycopeptides similar to vancomycin, but with half-life of 70 to 100 hours, allowing once daily dosing. Teicoplanin. Remember, teicoplanin takes its sweet time. One shot covers all day. Acid-stable penicillin used orally for streptococcal pharyngitis. I speak. Prosody rate 100. Penicillin V. Remember, Pen V survives stomach acid voyage. Cefamycin effective against Bacteroides fragilis in intra-abdominal infections. Cefoxidin. Remember, cefoxidin foils fragilis in the gut foxhole. Carbapenem most associated with seizures at high dose or renal failure? Speak. Imipenem. Imipenem. Remember, imipenem, impressive but induces fits if kidneys quit. Non-beta-lactam beta-lactamase inhibitor that also powerfully binds PBP2 with cefepime. Speak. S. Zidibactam. Remember, zidibactam zips onto PBP2 like superglue. Speak. Antistaphylococcal penicillin eliminated mainly by hepatic metabolism. Yes. Speak. Nafcillin. Remember, nafcillin needs the liver taxi, not kidneys. MIC creep for vancomycin refers to isolates whose MIC rises toward X micrograms per milliliter, clinical breakpoint. 2. Remember, when MIC hits 2, VAN feels blue. Alternative prophylaxis for rheumatic femur in penicillin allergic patients? Speak. Prosody rate 100%. Erythromycin. Remember, erythro marches in when pen marches out. monobactam that binds PBP3 and is inhaled for chronic pseudomonas in cystic fibrosis. Aztreonam. Remember, aztreonam aerosol annihilates airway pseudo. Third-gen cephalosporin lacking reliable activity against MSSA and anaerobes. Ceftazidime. Remember, ceftazidime skips staph and smelly bugs. Phosphonic acid analog that enters bacteria via glycerophosphate transporter. Speak, phosphomycin. Remember, phosphomycin sneaks in on G3P freight train. Cilastatin co-therapy is unnecessary with which newer carbapenem due to stability? Speak, prosody rate 100%, meropenem. Remember, meropenem works solo, no cilastatin chaperone. Maximum recommended vancomycin infusion rate to avoid histamine release, mg per minute. Speak, prosody rate 100%, 10. Remember, 10 milligrams per minute keeps Red Hulk away. Speak, cephalosporin causing hypoperthrombinemia and disulfiram-like reaction with alcohol. Cefoperazone. Remember, cephaloperazone makes PT prolong and party booze bad. Speak, acidophore cephalosporin has active against carbapenem-resistant Enterobacterales. Speak, prosody rate 100%, cefiderocol. Remember, cefiderocol steals iron to kidnap KPC bugs. Glycopeptide antibiotics are ineffective against VRE because they cannot bind D-ala D-termini. Speak, rate 100%. Remember, VRE swapped AL for LAC. Van slides off like soap. Speak, prosody rate 100%. Cycloserine neurotoxicity can be minimized by supplementing vitamin. Prosody. Speak, prosody rate 100%. B6, pyridoxine, air end, prosody. And speak. Remember, give B6 so cycloserine stops cycosines. Speak, prosody rate 100%. Penicillinase-resistant penicillin, preferred for MSSA native valve endocarditis. Speak, oxacillin, yes. Remember, oxacillin ox-drops staph on the valve. Standard triple therapy for prosthetic valve MRSA endocarditis includes vancomycin, rifampin, and then a brush. Gentamicin. Remember, gentamicin joins van and rif to guard the metal heart. Why is daptomycin not used for pneumonia? It is, by lung surfactant. Speak, inactivated is activated. Remember, surfactant hugs dapto and smothers its punch. Cross-reactivity in beta-lactam allergy depends chiefly on similarity of which side chain? Speak, prosody rate 100, rate 100. Remember, if R1 twins, rash returns. Depot benzathine penicillin G dose frequency for rheumatic prophylaxis, weeks? Every 3 to 4 weeks. Remember, benzathine pen G, once a month keeps strep away. Fidaxomicin. Remember, fidaxomicin fixes diff when van gives up. Carbapenem administered once daily due to longest half-life but lacks Pseudomonas activity. Speak, ertapenem. Remember, ertapenem, easy once a day, but no pseudoplay. Fourth-generation cephalosporin, often chosen for empirical therapy in neutropenic fever. Speak, frosity, no prosody. Remember, cefepime keeps febrile neutrophils feeling fine. Inhaled lysine aztreonam brand used in cystic fibrosis is called Caistin. Remember, aztreonam in CF goes by Caistin, the airway cowboy. Penicillin gentamicin synergy relies on penicillin damaging the cell wall to let enter. Speak. Prosody rate 100%, aminoglycoside. Speak. Remember, pen opens door, gent hops in with grenades. Which penicillins do not require renal dose adjustment because of hepatic clearance? Speak. Rate 100%, nafcillin and oxacillin. Remember, naf and oxa love liver, ignore kidneys. Carbapenems markedly reduce serum concentrations of which anti-epileptic drug? Valproate. Remember, carbapenems vacuum valproate. Watch for seizures. 400 to 600. Remember, ANZAN AUC 400 to 600 or fail. Single-dose IV glycopeptide that also disrupts membranes and interferes with coag assays. Speak. Prosody rate percentage 100%. Remember, oritavancin, 1 vial, many vices, fake INR. Which glycopeptide can be given intramuscularly when IV access is difficult? Teicoplanin. Remember, teicotolerates thigh shot. Combination cephalosporin plus new BLI active versus MDR pseudomonas. Ceftolozane plus ? Tazobactam. Remember, ceftolatazo tag team troublesome pseudo. Phosphomycin resistance often develops via loss of which bacterial transporter? Glycerophosphate transporter. Remember, bugs close the G3P gate, phospho left outside. Ampicillin sulbactam has excellent activity against which anaerobe causing aspiration pneumonia? Speak. Prosody rate 100%, Bacteroides fragilis. Remember, sulbactam slaps stinky fragilis. First-gen cephalosporins are remembered by TET mnemonic, covering Proteus, E. coli, and Speak. Prosody rate 100%, Klebsiella. Remember, cefazolin keeps peck pork in check. Ciftriaxone must not be mixed with calcium-containing solutions in neonates due to risk of lethal precipitates. Remember, ceftriaxone plus Ca equals coffin crystals. Immediate penicillin allergy is mediated by which immunoglobulin class? Remember, Iggy screens at beta-lactams like drama queen. Daptomycin rapidly depolarizes membrane by creating pores causing efflux of ions. Potassium. Remember, daptomycin pulls K out, bug goes flatline. Beta-lactams exhibit time-dependent killing, efficacy linked to time above which? Speak. Prosody rate 100%, MIC. Remember, clock beats concentration for beta-lactams. Vancomycin shows concentration independent, slow killing, but exhibits a modest effect. Post-antibiotic. Remember, Van plods on, bugs stay stunned after exposure. Imipenem paired with relebactam expands coverage against which resistant organisms? Speak. Prosody rate 100%, carbapenemase producing Pseudomonas and KPC enterobacterales. Prosody. Speak. Remember, reloads imipenem's lost ammo. Ceftazidime-avibactam combination is active against which class A beta-lactamase? Speak, prosody rate 100%, KPC. Speak. Remember, avibactam avenges against KPC killers. Amoxicillin causes maculopapular rash in almost all patients with acute Epstein-Barr mononucleosis. Remember, give amoxin mono, get a postcard rash. Methicillin and older isoxazolyl penicillins were abandoned due to high incidence of interstitial nephritis. Remember, methicillin made kidneys moan. Teicoplanin is generally less toxic than vancomycin at comparable trough levels. Speak, prosody rate 100%, nephro. Remember, Teico treats kidneys tenderly compared to Van. Cefepime can cause encephalopathy, especially in the setting of dysfunction. Renal. Remember, bad kidneys let cefepime seep into sleepy brain. Probenecid historically used to prolong serum levels of which gonorrhea therapy? Speak, prosody rate 100%, benzylpenicillin or ceftriaxone, legacy. Prosody, speak. Remember, probenecid props up pen in gonorrhea sprint. Clavulanic acid irreversibly acylates active site serine of which beta-lactamase class? Speak, prosody rate 100%. Class A. Remember, clavulanic clicks onto class A like crazy blue. Astrianam is destroyed by metallo-beta-lactamases that require which metal ion? Zinc. Remember, metallo-MBL loves zinc, munches monobactams. Carbapenems lack intrinsic activity against which gram-positive cocci? Speak, Enterococcus faecium. Speak. Remember, carbapenems can't erase enfamini. Daptomycin is FDA approved for right-sided, but not left-sided, endocarditis. Staphylococcal. Remember, dapto does right heart, left it left out. Ampicillin rash mechanism in EBV is non-trophical rather than IgE mediated. Immune complex, non-allergic. Summary. Remember, EBV rash is a fake allergic screenshot. Ceftobiprole is a fifth-generation cephalosporin that, unlike ceftaroline, retains activity against Pseudomonas aeruginosa. Remember, ceftobiprole bites both MRSA and pseudo. Bacitracin blocks the dephosphorylation of choline carrier molecule. Bactoprenol, lipid 2 carrier. Remember, bacitracin bashes bactoprenol back home. Speak, prosody rate 100%. Cyclosarin competitively inhibits alanine racemase and ligase. Speak. Diala. Remember, cyclosarin screws up a la racetrack. In necrotizing fasciitis due to group A strep, penicillin is combined with whisper to inhibit toxin production. Clindamycin. Remember, Clinda shuts the toxic stereo off. Carbapenems display post-antibiotic effect, particularly against rods. Speak, prosody rate, gram-negative prosody. Remember, after carbapenem, gram-negative stay grounded. Cephalexin is administered every 6 hours orally and belongs to which cephalosporin generation? First. Remember, cephalexin is first in line, 4 times daily. Benzathine penicillin G adult dose for early syphilis is million units IM once. Speak prosody rate 100%, 2.4, prosody. Remember, 2.4 megashot, syphilis out the door. Carbapenems are bactericidal by binding to PBPs and inhibiting which specific enzymatic reaction? Transpeptidation, cross-linking, and so. Remember, carbapenem cuts the cross-link chainsaw. The MEK-A gene in MRSA encodes an altered PBP known as PBP2A. Remember, MRSA's magic armor is PBP2A. Estrionam lacks activity against gram-positives because it has low affinity for PBPs of XXX bacteria. Speak, prosody rate 100%, gram-positive. Remember, monobactam ignores positive people. Vancomycin requires renal dose adjustment when creatinine clearance falls below n ml minutes. 50. Remember, below 50, trim the van ticket. Continuous infusion of beta-lactams can improve outcome because it maximizes %T.O. Speak prosody rate 100% MIC. Remember, keep drip above MIC, bugs sweat bullets. Tilavancin is contraindicated in pregnancy because it is in animal studies. Speak, the prosody rate 100%. Remember, telavancin tells babies goodbye, avoid. Cefuroxime is a second-generation cephalosporin notable for oral formulation called cefuroxime acetyl. Remember, acetyl Axe throws gram-negatives at dinner. Anti beta-lactamases are poorly inhibited by clavulinate but inhibited by avibactam. Remember, avibactam avenges AMC antics. Red man syndrome can be prevented by pre-medication with intravenous blank. Diphenhydramine antihistamine. Remember, give diphenhydramine, keep van man pale. Bacitracin is active only against which gram category? Speak gram positive, unquote. Remember, bacitracin bashes positive buddies on skin. As speak, oritavancin displays concentration-dependent killing and a prolonged F effect. Speak, post-antibiotic. Remember, oritavancin one shot but a stunned for days. Beta-lactam serum half-life is generally short, except when formulated with repository salts, like penicillin. Speak, prosody rate 100%, procaine. Remember, procaine pen drips out slowly like honey. Which anti-pseudomonal penicillin at megadose may precipitate seizures by inhibiting GABA? Iparacillin. Remember, megapiperacillin pips GABA, sparks fits.